Aloha, my name is Josh Green and welcome back to Healthcare in Hawaii. I'll be your host today and I'm with Kalani Brady, physician from our community, legend really in our community, even though he wouldn't like to say so. He's been advising us on healthcare matters for many years, 19 years on his own television program where he really reaches out to people. And so this is a great opportunity for us to expand our discussion, in this case with a clinician who also is I'd say a public health advisor to the people of Hawaii. So I'm so honored to have Dr. Kalani Brady here joining me. Before I give him the mic, I wanted to say that Kalani was raised here. He went to school at St. Louis, so he has his St. Louis ring on his hand. He also was over at Harvard and University of Pennsylvania, which we won't hold against him. We will really focus on his St. Louis time.
That's right.
And then he's at Jabson, but he comes in his own capacity as a citizen physician today. He represents his own views. But Kalani, I'm so honored to have you here on our show.
I'm honored to be with you, Senator.
Great to see you.
Good to see you.
A lot of times we've talked on my program just very specifically about one issue, but you have several areas of expertise, so I'm hopeful that we'll get to several things today. But because you have really been engaged with healthcare policy here on the ground level for many years, I thought we'd take the opportunity to also broach the subject of the Affordable Care Act.
Yes, absolutely.
So a lot of our guests, as we talked about a little bit before, were from the insurance industry, and there were a few physicians, but could you give us your perspective on the Affordable Care Act in our first segment?
With my background as being a physician first at Kalihi Valley for 3.5 years and then part-time with Waianae Coast Comprehensive Health Center for 6 years,
yes.
I've had the pleasure of taking care of people that were truly in need. And the Affordable Care Act is basically an attempt to give everyone insurance and a little prod to make sure everyone gets that insurance. That's really important because the uninsured previously have been really scared of, what do? I don't have insurance, but I don't know what to do, so I'm not going to go to see the doctor. And so there has been an unfair burden not only on the poor patient without insurance,
yes,
but a burden on the healthcare system, emergency rooms, hospitals, doctors who basically are given this patient with lots and lots of problems because they haven't gone in to check them when they were smaller problems. And the outcomes of health care when someone has waited on problems is much worse than if you catch it early and potentially you can cure smaller problems.
So you're basically saying that by passing the Affordable Care Act and putting into motion a way for all Americans to get health insurance, we'll be able to get rid of that problem. As a clinician, we won't any longer be playing catch up with people who haven't had care for 5, 10, 20 years. Is that the big benefit?
That's correct. And hopefully it will engender a sense of responsibility for each patient. As they have health care, hopefully they will use their health care. And obviously, the doctor can do so much, right, but the patient can do much, much more. And the partnership between doctor and patient in healthcare is crucial in maintaining and improving, maximizing the health of our citizens, of our people. So I hope that affordable healthcare and the presence of insurance for all will keep people healthier in their own commitment to themselves.
So by removing that barrier, that concern of can I possibly even get insurance, and then take it to the next level and go find the provider, we'll have a real relationship a long-term relationship between the primary care provider. Now you said that you were in internal medicine, is that right?
Correct.
So that means you see people from what age to what age, just for our audience?
Well, actually I was very fortunate. When I first started in practice, I saw kids, and I had pediatric privileges at Kapiolani because I did a primary care internal medicine track. So I saw kids down to about 2 years old. Now I don't have that competence that I used to have, so I see people from 15 to 18 on. But it means in primary care, the joy of primary care, yes, is that you have generations. You not only have patients, but you have generations of families. I've taken care of grandparents, parents, children, and now they bring their grandchildren into the office. So it's an extremely rewarding practice. And I have patients that have been with me for 30 years.
That's really quite extraordinary. And I think that's what healthcare was supposed to be about. I trained in family practice, and
Same thing.
Same thing, exactly. Had exactly the same experience. And I hadn't Hawaii is the first place I've ever been for a long period of time. I came out of residency and then have only been in practice here. But even just in my 13 years in practice, I've been able to start seeing, I've now seen a couple kids that are the children of young women who help deliver their babies and whatnot. So
isn't that great?
It's really great. And to know now that they'll be able to get insurance, like you said, without that worry from the Affordable Care Act is very gratifying. What else about the Affordable Care Act or the changes in healthcare over these last few years have been notable for you?
I want to talk about the ACA, the Obamacare Affordable Care Act, with a caution.
Yes.
Right now, if somebody calls up or tries to use the computer, sometimes there are glitches.
Yes.
They will be fixed. Anytime you implement a huge system nationwide, including in the state of Hawaii, but nationwide, you're going to have glitches. And a lot has been made in the news
Yes.
of the problems of getting on board. I have friends that have had trouble getting on board. Those problems are improving. The same friends that had trouble a month ago, 2 months ago, are now able to have the same person, in many cases, talk to them on the phone. They're able to get on the internet and get through. So what I would advocate the people of Hawaii to do is have patience.
Good.
It's a good idea overall. It's frustrating. It was frustrating a couple of months ago. It's better now, and I have every expectation that it's going to get better in the future as well.
Yeah, I think so too. And I think that a lot of these things take a certain comfort level. Any major systematic change takes comfort level for any of us. So I think that's what we've been doing. And we've been trying to encourage people statewide, like you said, be patient. The overall benefit, if you can get to that finish line and get the insurance enrollment behind you, it'd be so much easier the next time and the next time. And also, if I'm not mistaken, the Affordable Care Act had other benefits. There is no longer a lifetime cap on people's care.
Yes.
People can't be denied insurance. Would you like to comment about that? In your clinical experience, did you have patients that came to you and said, Dr. Brady, I can't get insurance because?
I have. I've had friends as well. Because I'm involved in the entertainment industry, I frequently have performers that come to me and say, you know, they won't let me have insurance because they're on individual plans and it's difficult. I understand the point of the insurance company,
Yes.
but they aren't. These patients aren't hired by a big company that can enroll everyone. They're hired they get insurance on a case-by-case basis, and unfortunately some of them can't qualify. Affordable Care Act takes care of that.
Yeah, that's, I think, been an experience with that industry. And then you also had a lot of smaller mom and pop industries in the state of Hawaii where people were just, maybe they hung a shingle and they were a real estate agent.
They couldn't afford, as a small company, to offer insurance to a very small employee group.
Yeah, and I think that's another thing that people should be aware of, that it's not really one size fits all. This is a very complex problem, which is to get 45 or 50 million additional people insured. Why don't you make a few comments before we go to our first break? We have a few minutes still, maybe 5 minutes, because you've been very committed to the community health center system, and a lot of individuals that come to our community health centers are on Medicaid, not all, but the expansion of Medicaid, and what will that mean? Do you think community health centers will get stronger? Is it going to be valuable, or is it a problem, do you think?
I see the community health center, our Department of Native Hawaiian Health, and I'm speaking as a private individual today,
Yes.
but I observe the Department of Native Hawaiian Health working with community health centers and the Native Hawaiian healthcare systems, and I see these people committed to a cause. The employees are not just employees. They're basically shouldering responsibility for the provision of health care to their constituents, and that's really exciting. That means that they're working on other areas than just medical care, because health isn't just about medicine. Health is about a lifestyle. It's about commitments you make to yourself. And in our community health centers, I see that. And if people go to a community health center, they get sucked into that sort of, let's be responsible for ourselves. Kokua-Kalihi Valley has community gardens, for example.
Yes.
And Waianae Coast Comprehensive is so broad in what it offers, including Native Hawaiian healing. It's great to see those kinds of things. In addition to that, as I mentioned, the Native Hawaiian healthcare systems are throughout every island, and they receive federal subsidy, as do the community health centers, to take care of people, in many cases privately insured,
Yes.
but in many cases people who may not have yet insurance join the ACA, but the people that need health care,
Right.
and they are more comprehensive than a doctor's office. They, again, look at overall health maintenance and maximizing health, spiritual health, psychological health, physical health. It's all one package. And then there are the teaching clinics. People say, oh, I don't want to go to a student. You know, the students are among the highest quality providers we have sometimes. They're closely monitored by faculty. They're taught the latest in academic medicine.
Yep.
And so places like Queen Emma Clinic at the Queen's Medical Center are phenomenal places to get health care and in a comprehensive manner.
It's all, yeah, it's such a good thing to have your perspective, because you're seeing it from several different points of view, which is very helpful. If I might ask you a little bit, because we have you today, over the past couple segments I had Neil Palafox, a good friend of both of ours.
Yes.
And Neil spoke very passionately about healthcare disparities. I wonder, since we've got you, could you comment a little bit about healthcare disparities and what you've experienced both in the Native Hawaiian community and purely at Queen Emma Clinic or at the university? Are you seeing the same?
Yes. Well, because my job is in the Native Hawaiian health field,
Yes.
basically it's important to note that we Hawaiians have among the worst health outcomes in our own land. This is our mainland right here.
Yes.
And our rates of obesity are high. Our rates of cancers of many kinds are high. Actually, the diagnosis of cancer is delayed in our people. Hypertension and heart disease are high. So we have worse outcomes than a lot of the other cultures of Hawaii. This is similar, I'm sure Neil talked about Micronesians and
Yes.
the difficulty we have with poor outcomes for Micronesians. And that's compounded, of course, by the fact that a lot of them lack insurance and really need to be insured.
Yes.
They deserve good health just like every other person. It's an inalienable right that we have.
Yeah, and he did make that point very passionately, and I wanted to hear it from you too, because it's nice for me to corroborate people's perspectives. And though that issue continues to come up, I think that what we're seeing is we're beginning to take bites out of the problem, but it's much more complex than just getting people insurance.
Yes.
So we're going.
Trust is a real issue, and we're going to talk about trust perhaps a little later in the program. But if I had a wish list that I could put a wish on there to be fulfilled, it would be that there would be a better trust relationship, that the gap of distrust would be bridged between healthcare provider, be it a nurse, be it a social worker, be it a physician, and a psychologist, and the patient. That trust existed so that the patient would maximize their opportunity for their health.
Yeah, and we seem to be in an age of distrust,
Yes.
right? And what I think we could say is we'll allow people to save all of their distrust for just the politicians, and we'll let them convey their trust to the good practicing physicians in our community.
Well, I think politicians like you are obviously working very, very hard at solidifying our state's offerings of health and many other areas.
We're certainly trying to be right by people for health.
Yeah.
So I think this might be a good time to take our first break.
Okay.
So why don't we do that, and when we come back, let's talk about hepatitis.
Hepatitis.
Excellent. So this is Josh Green on Healthcare in Hawaii. I'm joined by Dr. Kalani Brady, a healthcare expert in our community. Thanks for joining us.
We want to thank our underwriters.
Hawaiian Electric Company and its affiliates Maui Electric on Maui and Hawaii Electric Light Company on Hawaii Island are deeply committed to the communities they serve.
Galen Ho is a senior executive of BAE Systems, a global defense, security, and aerospace company.
The High Tech Development Corporation, the state's leading technology agency, attached to the Department of Business, Economic Development, and Tourism.
Castle and Cook Hawaii, with a time-honored legacy that spans more than 160 years and revolves around its mission of investing in Hawaii, creating communities, and providing for the needs of our state.
Hawaii Gas, formerly the Gas Company, a proponent of the Liquefied Natural Gas Initiative, helping Hawaii achieve its transition to clean energy and a better energy future.
Collateral Analytics, a Hawaii-based tech company empowering the real estate industry with greater and faster access to the tools and data they need to make better informed property investment decisions.
I'm Nicole Horry. Thanks so much for joining us on Think Tech.
I'm Maria Kashem. See you next time.
Aloha, welcome back to Healthcare in Hawaii. I'm your host, Josh Green, Senator from Big Island and ER physician by weekend. Today I'm joined by Dr. Kalani Brady, who's a healthcare expert in our community on many levels. Kalani, in his first 15 minutes with us, was able to focus on some of the benefits of the Affordable Care Act, in which he hoped that people would trust the system, would reach a point where they went to the exchange, where they got their insurance, so that we could begin to break down that challenge that many people have of being uninsured in our community. But his breadth of experience in Hawaii is quite far-reaching. He's been advocating for community health centers and a comprehensive approach to healthcare for many years. Today I have the opportunity to ask him some specific questions about emerging challenges in our healthcare system and challenges for our people. One of those areas is hepatitis C. So I've been out of the loop for many years on hepatitis C, and I thought that this would be a great opportunity to speak to you when you offered that up as an area of your interest.
Very good.
So why don't you kind of just give us an overview? Where are we with hepatitis C in our state? How many people are affected? What's treatment like? Why don't you start us in?
Okay. Hepatitis, for background,
Yes.
is an inflammation of the liver. Across the world, the biggest cause of hepatitis around the world is parasitic hepatitis. Here in America, we don't have as many parasites. We're very fortunate to have a public health clean economy and clean environment in a lot of ways. So three types of hepatitis, there are several more types, but three major types of viral hepatitis are important. Hepatitis A, or foodborne hepatitis. This is when we eat raw shellfish that's contaminated. We don't have a lot of hepatitis A. It can also be fish that's raised in areas where hepatitis A virus is in the water. It is a self-limited disease. It makes you feel quite sick, like a stomach flu, for perhaps several weeks, but you recover. And there's no real need to treat. And so it's not a disease that causes cancer of the liver or a lot of serious long-term outcomes.
Okay.
Hepatitis B. Hepatitis B is generally a blood-borne infection. It can be caught by unprotected relations. It can be caught by needle sticks.
Yes.
It can be caught, of course, by tattoos, and that's why old style tattoos may not be the safest. I have a tattoo and I used modern tattoo with sterile technique for my family tattoo. But hepatitis B you can have unfortunately for life. The good news is that hepatitis A and hepatitis B both have vaccines to prevent their transmission to you. And as a matter of fact, travelers who are going to third world countries frequently get hepatitis A and hepatitis B vaccine to prevent that being an unfortunate part of their vacation.
Right.
Hepatitis B can be treated, but it is lifelong basically. It has a very small risk, but it does have a risk of hepatocellular carcinoma, hepatoma, which is a liver cancer that can kill. Hepatitis C is even worse than that. It's harder to transmit than hepatitis B, but 1 out of 50 people in the state of Hawaii probably have hepatitis C.
Okay.
That's a lot of people.
It is a lot of people. And well, why don't we tell our viewers how you get hepatitis C before we talk about treatment and what have you?
The same ways basically as you get hepatitis B, although it's not as easily transmitted. So, tattoo needles, transfusions, although not now, but back in the 80s before we did a lot of blood testing, before giving blood, there were transfusion transmitted hepatitis C.
Right.
IV drug use, unprotected relations, again, are ways that you can catch hepatitis C.
And what's the, because I saw a lot of people with hepatitis C when I was working in KAU, but sometimes a patient was someone who we didn't historically predict would have hepatitis C. A woman came in to me, 67 years old, had been only with her husband for gosh knows, decades. He passed away, and in the course of her regular routine checkup, we found that she had hepatitis C. Is that normal?
It's not real common, but it does occur, and one of the postulates I would have, one of the explanations that I would think about was, did she have a transfusion prior to the time when we tested blood for hepatitis C.
Sure.
Or obviously there aren't many 67-year-olds that have tattoos, but there are some of us
Yes.
that have tattoos, and she could have gotten it with receiving a tattoo.
More every day, I see.
Yes,
I see
indeed.
it. Okay, so people come to you, you're their clinician, they tell you they've got hepatitis C, they're in the 2% of people in the state of Hawaii. What do we do for them?
Well, this is really important. People don't know they have hepatitis C.
Okay.
This is a disease that in end stage can lead to significant cirrhosis or scarring of the liver, i.e. failure of the liver.
Right.
And it can lead to death because of cirrhosis of the liver.
Sure.
In addition to that, it is a frequent cause of hepatocellular carcinoma that we talked about, that liver cancer that hepatitis B has a small relationship with.
Yes.
Hepatitis C has a much more common relationship with that. So you don't want someone with hepatitis C to go undetected for a decade or 2 decades and then come down with end-stage serious disease. And the good news that has occurred in the last year or two is that hepatitis C is curable.
Excellent.
And so what we need to do is test the unsuspecting ladies. We surely should test everyone who might have a risk factor for receiving hepatitis C.
Let's go over that again. Like, so drug
use,
unprotected partners.
relationship, the use of tattoos, receiving a blood transfusion before about 1982.
Okay.
Those would be risk categories.
Yes.
Being a healthcare worker because of the potential for
Sure.
injuries as part of just doing routine healthcare.
Yes.
Those people should be tested for hepatitis C, and there are some advocates, Senator, in this state that say that every person should be tested for hepatitis C.
Interesting.
Because this cure that we have, it's serious medicine,
Yes.
it's less than a year, and it cures. We can't cure hepatitis B, and of course, the party line for decades with hepatitis C was, you have hepatitis C, I'm sorry. We
Well-
can try and retard it. We had pegylated interferon, we had ribavirin, but made people sick and we couldn't cure them.
Right.
Now we can actually cure hepatitis C.
So let me take a half step back and then let's talk about the cure. So the test, to find out that you've got hepatitis C, is a blood test?
A simple blood test,
Okay.
which you can get with your doctor ordering other blood tests. Testing for diabetes, testing for kidney disease, testing for cholesterol,
Good.
the kind of things that we do routinely. Hepatitis C can be done in that same blood test.
So you're saying, I guess to be consistent with what we said earlier in our first 15 minutes, trust your physician, be open or honest with him or her. If you've had any of the risk factors, like had a tattoo that you thought maybe could be a challenge, but really maybe any tattoo, or if you had unprotected relations or you were a health worker, add that into your conversation, that trusting relationship you have with your physician. Now that you have health insurance through the Affordable Care Act or whatever other
Exactly.
mechanism, make that a part of your dialogue with your primary care physician so you get that test. Now let's flash forward. You've had the blood test and your physician or even your nurse practitioner or whomever's taking care of you says, I'm so sorry, Josh, you have hepatitis C. What's next?
The medication is next, and this month a medication is coming out. The medication that's been used for a year is a long year.
Yes.
It's making you ill for a year. The reward at the end of the year is you're done with the medication.
Yes.
You don't need any maintenance medication. You are cured of hepatitis C. But in the next month, there are medications that are going to come out which lead to only 6 months of treatment, and then you're cured.
What do they call that? I'm curious.
Oh, there are really fancy names.
Okay.
But the docs will know the medications.
Yes.
And using those medications, like I say, brings you a gift of life.
Is it pills that people will take?
It's pills.
Okay, so people will take pills daily or weekly?
Right. Until a month ago,
Yes.
it was a combination of pills and injections, and the injections were sore. Now the medications are just oral pills.
Amazing.
Yeah.
And it's refreshing to know that there are developments, especially for an issue that's a public health problem. I mean, 1 out of 50 is very, very
A lot of
significant.
people.
That's a lot of people. I mean, we have how many people in our state? 1.4 million?
Yep.
It's a lot of people out there that probably don't know that they have hepatitis C. Is that correct?
That's correct.
And now if they go to their primary care physician, or do they have to go to a specialist for this treatment?
Nope, just the regular primary care physician. Ask your doctor or nurse practitioner about hepatitis C.
Okay.
Should I be tested?
And if they go through that treatment, what's the % chance that they'll be cured?
95?
Wow, that's really something. So it's almost along the lines of an antibiotic. In the historic, if you had an infection like pneumonia, you took an antibiotic, you had a very good chance to get better. Now this is a treatment for a virus, and it can get you better. And during that period of time, are you able to work still? Are you able to, or is it going to cause a lot of side effects?
It will cause a lot of side effects. I'll be honest about that.
Yes.
It's a period of time during which you will lose weight and you will feel junk.
Okay. Like you got the flu,
Yeah,
kind of?
like you've got the flu.
And you take medicines to help you with that?
You can, you
Okay.
can. But if you're 30 or 40 or 50 and you have hepatitis C and you go through this 6-month course of therapy,
Yes.
You might liken it to the chemotherapy we use with much lower chances of cure for cancers, for example.
Right.
Hepatitis C, you go through this miserable period of 6 months, but at the end of the tunnel, you have life.
Yes.
And there are no long-term effects to the medications that we really know about. It's really that you are cured of a deadly disease.
Will you also then be at lower risk for transmitting it to your significant other?
Oh, absolutely. The viral load of hepatitis C with treatment for some time has been brought to 0. But hepatitis C, unlike B, which replicates over the course of a day or more, hepatitis C replicates within hours. So those little viral particles are busy folks. And we were able to bring people down to a 0 viral load like we have with HIV, for example, but we couldn't cure them. And now there's a cure.
Amazing.
It is.
Well, this is a pretty good time for us to do a basic transition. I guess if you had anything else to add to the hepatitis conversation, are there other pockets of our population that are seeing higher incidences of hepatitis? Who else should we be speaking to?
Again, the Polynesians and Micronesians, because we do a lot of family tattoos, and a lot of our people get tattoos in the traditional style with bone, and I'm Hawaiian,
Yes.
but I'm a Western style physician,
Yes.
and I would recommend having a tattoo. I'd recommend, though, doing it by sterile technique.
Okay.
Yeah.
And that is very important, because otherwise you could end up both either exposed to a life-altering condition,
Right.
or now even if it's curable, it is still going to take its toll on you as a person for that year.
Right,
For that
and
6 months.
hepatitis C is not the only virus that's transmitted through tattoo, HIV.
Yes. And that will commit you to a lifetime of medication.
Right,
Yes.
and hepatitis B, which is also not curable.
Okay.
Yeah.
Very important messages. I think this is an excellent time to take our break. But I'm so gratified that I'm hearing from you both kind of the nexus between the cultural concerns that you would have as someone who's Hawaiian, and also how you're practicing. So to hear that there's a treatment is fantastic news, and we'll get the word out.
Yes, indeed.
Okay. So why don't we take a break here? I'm Josh Green with Healthcare in Hawaii. I'm joined today by Dr. Kalani Brady, and when we return, we're going to speak about some other issues, nutraceuticals, which is an emerging issue, especially because Oxylite Pro was in the media this last year. Thanks for joining us. We'll see you in a moment.
Aloha, I'm Nicole Horry for ThinkTech. For nearly half a century, the Hawaii Foreign Trade Zone No. 9 has brought the benefits of the Foreign Trade Zone program to Hawaii businesses and entrepreneurs. DBET, the Department of Business, Economic Development, and Tourism, operates Hawaii's Foreign Trade Zone program to encourage international business and economic development. The Foreign Trade Zone's mission is to increase the amount of international trading activity in Hawaii, thereby providing employment opportunities for the residents of our island state. For more information, see ftz9.org. I'm Nicole Horry. Mahalo.
Aloha, welcome back. I'm Josh Green, Senator from Big Island and ER physician. Today I'm joined by Dr. Kalani Brady, who's been very, very supportive of primary health care, community health care across our state. Grew up here, went to St. Louis, and then went off to the East Coast for his education, but now is a leader in our healthcare community. In our first two segments, we talked initially about the Affordable Care Act, and Dr. Brady was able to express that we need to trust the system as we work toward total insurance coverage for our community. It makes a difference for people to not worry about whether or not they can get care. They need to be able to trust the system, then have a primary care physician to work on many health issues, which brought us to our next concern that he spoke about very eloquently, and that was hepatitis in our community. In that segment, Dr. Brady was able to tell us that there are multiple forms of hepatitis, all viral, that we were speaking of today, A, B, and C in our first segment, but hepatitis C now has a cure for it over the course of 6 months. He made sure to really instruct people to ask your primary care physician to test you if you've had any of these issues. You've had a traditional tattoo perhaps and might have been exposed, whether or not you had unprotected relations with someone, especially that could have had hepatitis, or if you had a blood transfusion in the 80s. Those were 3 of the big areas. There are of course other issues in healthcare that can also touch on hepatitis, particularly what the outcome of hepatitis is if you go untreated. So that was an excellent conversation. Another issue that's emerged this year that also affected the liver, interestingly, was Oxy Elite Pro. This was a supplement that people took really to bulk up, to get muscular, but it brought up a bigger topic, which I was hoping he would touch on today, and that's nutraceuticals. So Dr. Brady, why don't you tell us what that word means, nutraceuticals, because that was the first time I actually heard it from a provider.
Nutraceuticals are those groups of compounds which are used with goals of weight loss, increasing muscle mass.
Yes.
A lot of the places that we buy those are in health food stores or vitamin stores.
Mm-hmm.
They come with sometimes even guarantees, but certainly claims that they improve health. And the caution I would have is that you have to examine those claims. Just because something's natural doesn't mean it's safe.
Right.
Poppy seeds are natural. Cocaine is natural. The heroin industry is based on natural products, but those are certainly not safe.
Right.
Same thing with some nutraceuticals, and we unfortunately learned about that with Oxy Elite Pro. So I would actually, again, advocate trusting your healthcare provider, be it a doctor or a nurse practitioner or a whole healthcare team, that they've actually done a fair amount of biochemistry study and other pharmacology study, so they can speak with some authority. And unlike some salespeople in some of these vitamin shops, they don't stand to gain $1 or lose $1 by the advice they give.
Right.
So they're not biased to tell you, you know, this really worked. I had an auntie that took this and she lived to be 112. It's based on scientific experiments and scientific data on studies.
And these, just so I understand better, these nutraceuticals, they're not regulated with quite the same rigor, is my understanding, as traditional pharmaceuticals. Is that correct?
That is correct. You know, I actually smile when I look at the nutraceutical the bottles, and they say, will help you lose weight on one side in big letters, and then on the other side it says, this product has not been evaluated by the FDA for efficacy. And so they're required to put sometimes that label on there, but it almost contradicts what they have as advertising on the front of the bottle.
Right.
A lot of times, in this case, I think with Oxy Elite Pro, they really weren't sure the concoction of ingredients that were in it. They knew what was in it, but they didn't know what percentage of each ingredient was present.
Right, and that's a big challenge. Why don't you take us back a little bit on this Oxy Elite Pro controversy or episode, because a lot of people died, if I'm not mistaken.
There were several people that died, and I don't want to, I'm afraid to comment too much because I think that there's some regulatory issues regarding the drugs, if I can call it a drug.
Yes.
So I would actually, you know, another natural product that I use, Ava.
Okay.
Ava is used by Polynesians and Micronesians in ceremonies,
Yes.
and we use it for relaxation. It causes liver failure in large amounts, especially when used with alcohol. So responsible AVA salespeople or providers will actually not give AVA to somebody who's drinking alcohol. And what does alcohol do? Well, alcohol causes liver failure too.
Right.
So it's not like AVA is a dangerous medication or a dangerous nutraceutical.
Right.
I use it, as I say. What happened was too many people, especially in Europe,
Yes.
15 years ago, used AVA, and a bunch of them died of liver failure. So everything in moderation is a good maxim for things. But asking your doctor about all the things you take in addition to the medications that you take
Right.
is probably wise. Give your doctor the chance to at least tell you about things. You can make your own decision, but ask your doctor. Bring the bottles in. Let your doctor examine the bottles, and you might find that you're spending more money than you need to because these things may not be owning up to their claims.
Right. And I think one of the other points that you were making earlier was the sense of trust between provider and their patients is important. So I guess what you're saying is, though some of these chemicals are nutraceuticals, they might be fine, but you need to be very open and clear about what your other lifestyle choices are, whether you're a drinker of alcohol or not, whether or not you take other drugs or not, because that's going to be private information between you and your
it's
provider.
sacred. It's not like that protected health information is going to go somewhere else.
Right. Yeah, so then they can, I guess in the kind of the broader context of the supplement, they can say, well, that would be fine if you're not doing this, this, or this, or be careful and cautious because this was the research. I think that that's what you're trying to
Absolutely.
convey. Okay.
Now, here I'm a doctor, I'm supposed to know these things.
Right.
What do I take?
Yes, what do you take?
Okay, I used to take a baby aspirin a day because I have high blood pressure and high cholesterol.
Yes.
And I hopefully exercise and moderate my diet so that my personal responsibility to lower those numbers is in effect. But in addition to that, I take medications for those things.
Yes.
Because I'm at risk for heart disease, I used to take a baby aspirin until during the 50 push-ups I do a couple of times a week caused my nose to bleed as it was in the dependent position. I then stopped the baby aspirin. But many people at risk of heart disease, a baby aspirin 81 milligram might be appropriate as recommended by the doctor. I take fish oil. I take fish oil a gram, usually twice a day, and I refer back to a cardiologist from Stanford who said it's the only ingredient that's been proven to lower the risk of heart disease. He was talking about heart disease directly, not hypertension, because of course if you control hypertension, you lower the risk of heart disease. If you control cholesterol, you lower the risk of heart disease. But fish oil as a medium by which to lower heart disease risk is a wise move. And I don't take a multivitamin. I take calcium. I take one a day, calcium plus vitamin D.
Okay.
For men, osteoporosis is less of an issue than for women, but it is still an issue.
Interesting.
And with women, especially our Asian population, they should be on calcium, vitamin D a couple of times a day. Ask your doctor what's appropriate for you, but in general, I would say twice a day for women.
And these are things that fall into the category for you of nutraceuticals, would you say?
Sure, vitamins, the whole industry of vitamins and nutraceuticals, yes.
Excellent. It's so interesting to hear you speak both personally and from a public health perspective on what's good, because I think a lot of what we've talked about on the show in past session segments has been about prevention and about encouraging people to do these things that will keep them away from needing a cardiac procedure, bypass surgery, keep them from possibly needing some advanced transport from our neighbor islands where it can be very challenging because of our healthcare provider shortage, which you and I are very aware of, and we've had people speak eloquently about. So I'm so pleased to hear that this is part of your kind of gestalt, so to speak, as a healthcare provider. Do you have opportunities when you're seeing patients? Do you have enough time to share these things?
You know, that's a challenging part, as you know, Senator. Seeing a patient in a 15-minute visit and addressing 4 or 5 chronic illnesses doesn't always leave time to discuss the nutraceutical vitamin industry. But we do make an attempt to do so. We also make an attempt to look at their diet every visit.
Yeah.
If someone comes in for a hangnail, I look at what they've eaten for the last 36 hours. They don't do the diet recall for me. I don't see them for the hangnail.
Interesting.
But we actually try to focus on what you and I as patients, what you and I as citizens can do for ourselves, in addition to what just the doctor can do for you.
I think that's so valuable, and one of the things that's been talked about a lot lately, and that I read a little article about the other day, was that the healthcare system is changing a little bit, and there might be more group visits, for instance, where people might have a similar issue in their lives of healthcare, and they might come to a physician and see with 6 people to have a more kind of like a little seminar conversation. Maybe they could then have, instead of just 15 minutes, they might be able to get an hour for those 6 people. Has any of that emerged in your life as a practitioner
yes.
yet?
The university, again, I'm a private citizen, but I can tell you in the Department of Native Hawaiian Health of the medical school,
Yes.
we have something that has springboarded off of patient-centered medical home, which we actually support wholeheartedly.
Yes.
It's called the Native Hawaiian Medical Home. And it includes pharmacy, psychology, practitioners of Hawaiian healing arts,
Yes.
as well as the doctors. And our clinic works with a whole team that sees patients. And my impression, of course, is that we are fairly successful at reaching our Native Hawaiian population.
I think that's wonderful, because I know that many people have come and spoken passionately about the health disparities, like you mentioned earlier, the higher risk of hypertension or high blood pressure, the higher incidence of heart disease and stroke in the Native Hawaiian population. And to be able to take new approaches, I think, in some way harkening back to Talk Story, right, where large groups of people come and talk about their experience, but now they have also the added luxury of having a trained physician and psychologist and a pharmacist all speaking together as a team. I think you're going to really be able to make large strides on some of those health disparities.
We certainly intend to.
Yeah, it's really terrific to hear. We have a few minutes before our third break, and I thought maybe I'd bend your ear about other emerging issues. You have spoken, I've heard you speak about obesity in society. I thought maybe I'd get you to comment on that issue, perhaps sugar-sweetened beverages, sodas. I know that you've got strong opinions about these things. Could you give me some perspective?
Absolutely. I sit, fortunately, on the board of the American Heart Association here in Hawaii.
Okay.
And one of our agendas is actually to reduce and control sugar-sweetened beverages. Basically, sugar-sweetened beverages are the same as calorie-loaded beverages.
Okay.
So it's not like the water that we drink that's basically pure. It has calories, and we have an obesity epidemic, and we have a diabetes epidemic. And if we're loading ourselves with colas and sodas and candies and pies and that kind of thing, there's no brainer to knowing that we're going to get heavier.
Yes.
And exercise alone may not be enough to control that. It really has to be control of our diet. So if we limit the availability of sugar-sweetened beverages in places such as vending machines, especially in schools,
Right.
in commercial establishments where people are encouraged to get water or other things than a sugar-sweetened beverage, I think will make an impact on obesity, and then all the diseases that obesity causes, everything from a whole bunch of cancers to the diabetes and other diseases, heart disease.
Yeah, I think that's important to mention, that it's not just about the weight gain, and it's not even just about the diabetes, which now, it's my understanding, of our $3 trillion in healthcare across the country, we're spending $300 billion on diabetes alone. I mean, that's like almost the size of our defense budget, to give people perspective. So in defense of our own health, we need to really solve this problem. But tell me a little bit about those cancers. There are, you said, some even increases in cancers because of obesity.
Yes, stomach cancer. There are a whole bunch of cancers that increase with obesity.
Okay. Well, I think it's so important that you mentioned that, and I'm really grateful actually that you're also helping to kind of fortify those comments that were made before. We've had people who are passionate about that as their single issue, but obviously this is a broader health issue for our community.
Right.
So why don't we do this? We'll take our final break. Oh,
There's our water.
Promotion of water, which is good. And we don't like to just pick on the soda companies. However, they are empty calories and they are part of the problem. I think that's become quite clear. And to hear it from a health leader is valuable to me anyway.
Thank you.
So let's take our last break, and when we come back, we're going to ask for your vision of healthcare. All right?
Absolutely.
Okay. I'm Josh Green. I'm your host today on Healthcare in Hawaii. Thanks for joining us.
I'm Hong Jiang, host for Asia in Review on Tuesdays.
And I'm David Day, host for Asian Review on Thursdays. Both of us broadcast our respective shows at 4 p.m.
And my topics tend to deal with questions related to environment, culture, history, and sometimes human rights.
And my shows tend to be on international business, foreign policy, geopolitics, and national security. And you can watch our shows live on the ThinkTech website at thinktechhawaii.com.
And you can also watch us on YouTube or Olalo.
So come join us on Thursdays at 4 p.m. I'm David Day.
And on Tuesdays at 4 p.m., I'm Hong Jiang.
Aloha.
Aloha.
Aloha. Welcome back to Healthcare in Hawaii. I'm your host, Josh Green, State Senator from Kona and Ka'u, and also an ER physician. Today I've been joined by Dr. Kalani Brady. Grew up here, went to St. Louis School, went off for his training, and came back as a healthcare leader. In our segments today, he's spoken very passionately about several issues. First, on behalf of the Affordable Care Act and some of its better provisions, especially getting insurance for people so they can see their doctor. That was very helpful. He also has spoken passionately about trusting your physician when it comes to other issues. Trust them when you share your health history, because he knows a lot about things like hepatitis, especially hepatitis C, which now can be cured. And we had a whole segment about that. But if you don't get the diagnosis by asking for the test because you say had a traditional tattoo, or because you had a blood transfusion or a sexual partner that perhaps had hepatitis, if you never know, you can't get the treatment. And it's very important now that it can be cured. We then went and talked a little bit about nutraceuticals, and those are some of the chemicals that people take. They could be vitamins, they could be compounds to help beef you up, make you stronger, but they do also have an impact on your global healthcare system. As we know from the OxyElite Pro incident, it can cause major problems, and that caused liver failure and ultimately death for several people. But Dr. Brady's an expert on so many things. I wanted to take this last opportunity just to say, Dr. Brady, what's your vision for healthcare? What will healthcare look like 5 years and 10 years down the road if we're very proactive and we make good decisions as a system?
Well, in the patient-doctor relationship, let's start with the patient.
Yes.
My vision, my dream for healthcare in the future is a patient that strives for personal health, that basically lives a lifestyle that in Hawaiian we call pono, that they exercise regularly, that they're spiritually, culturally grounded, that they eat a healthy diet, which is a lot more natural foods than a lot of the prepared foods that we eat today.
Yes.
That they have a healthy home relationship with kupuna, grandparents, parents, children, and mopuna, grandchildren. Mm-hmm. And that they trust, as you say, their doctor and their healthcare team. But let's talk about the doctor relationship part.
Okay.
I have the vision that the doctor will be perhaps the captain of the ship, but the doctor will not be burdened with the sole responsibility of healthcare provider for a population, because the doctor may not be the most effective person to share with the patient how they can maximize their health. The team is going to include nurses, nurse practitioners, pharmacy specialists, especially given the complexity of today's medications and the nutraceuticals and their potential interactions with pharmacy drugs. That it's going to include psychologists and counselors, masters of social work, and sometimes Lomi practitioners for massage, sometimes Ho'oponopono practitioners for community health or Ohana health, family health. Mm-hmm. That's really my vision for the future, is a solid patient-provider relationship where the patient takes the primary responsibility for their health and life. We have the opportunity with a with the magic advances that we've had in science, to live healthy to 100. Now, 3 of my 4 grandparents were dead by the time they were my age.
Wow.
That doesn't have to happen for us. We have a population now that says somebody is young when they die if they die in their 70s. Isn't that remarkable and wonderful?
And you're saying that maybe the next generation will be able to say that about people in their 90s.
That's right. That we can all be centenarians, or many of us can be centenarians and live more than 100 years of age. The Okinawans do it. And with the proper responsibility that we have for ourselves, the pride that we have in our bodies and family and culture and nation, that we actually achieve that.
I'm so pleased to hear that. Well, I don't think I could say it more eloquently. So it's been wonderful to have a practitioner and health leader here with me. And I would note, interestingly, you did not mention the hospital when you talked about your vision for healthcare. And that's an interesting thing. And I think we could talk about that even more. But to focus on the family and the responsibility for patients and that special relationship that we have culturally with each other here in Hawaii, and that being what healthcare and your vision for healthcare about, tells a lot about you as the man. So thank you for joining me here today.
My pleasure, Senator.
Great to see you.
Good to see you.
That's it for our show today. I've been so honored to have Dr. Kalani Brady here with us. I'm Josh Green, your host of Healthcare in Hawaii. See you next week.